On the forehead, anything there? Okay. Okay, how are you? Good. So, we're going to be looking at your nerves along your face, okay? And we're going to be tracing those, just trying to map out where they are, okay? Alright, so have you been experiencing any pain on the face? Okay. Alright, so to begin with, I'm going to be just using a very soft piece of cotton on the end here, and I'm just going to be testing the nerves along the face, okay, just to identify where you may be experiencing some discomfort or pain. And that will allow me to understand which branch of the nerve may be damaged. Okay, so let's have a look. I'm just going to come a little bit closer. Alright, let's see. Any pain there? Let's try this side. Pain there? Okay. So I'm just going to be doing some movements across the face that are symmetrical. Okay. Any pain at all? Okay. On the forehead, anything there? Okay. Let's go around on the cheeks. Any pain there? No, okay. And on the chin area, any pain there? Okay. Right. Just get on the sides of the face. Anything on that side? Okay. Here on the chin area. No. Let's try on this side. Anything there? Okay. And just the lower cheek, chin there. No? Okay. Okay, just doing longer strokes now. Anything at all? Okay, let's try. Now this is a pencil, it's not sharp at all, okay, but it will allow me to maybe trigger some more sensation than the cotton wool does, okay. Anything there? Okay. There. So something slightly there. Okay, let's try this side. Anything there? Okay. What about there? Okay. And on the forehead? Okay. And just do under the eyes. Anything? Okay. Nothing when I do this. Right, okay. Okay, I'm just going to clean the face. It's just a water-based solution, okay? Look up for me. Okay, and down. Just drying off the face now. Okay. Right, I'm going to start mapping out the nerve on the face, okay? So I'm going to be making some marks on my ruler here, and then I've got some paper I'm going to trace. Alright, so let's start over here. So just if you could just look at my nose, that's great, just so I can get the face nice and straight. Just getting these from the sides of the face there. Okay. Now they branch out from the sides of the face towards the middle like this, so I'm just mapping out based on your sensations and what I understand about the nerves, where they are roughly, and then we're going to trace over the face. just making some marks on the ruler and on the face, just to get some basic lines. And any sensations that you have been getting, has that been late at night or in the mornings? Sometimes if you haven't slept. Okay. And are you on any medication? Okay. Yep, got you. Okay. Just as I said, getting some basic lines. Let me just check some of these. Let's do these sides. Okay. Now, I'm just going to press along these lines I've made, and just let me know if there's any triggering pain there, okay? Okay. Right. Alright, so no sharp pains you're feeling. Okay, you mentioned that there was some discomfort just here. Alright, we'll focus around that area. make sure that I've not missed. Sorry, just look at my finger. I'm just double checking that I've not missed anything. Obviously it's very difficult because the nerves can't be seen from the skin, so I'm just looking at both sides. Just look here. And there. And there. Just close your eyes. And open. Okay. Just give your face What I'm doing is I'm re-engaging all the nerve endings using this brush before I start tracing. Okay. Right. Okay, I've got some special medical paper here. I'm just going to fold this. Okay. So I'm going to need to come quite close. Right. So I'm just tracing over. Okay, you're doing really well. Just stay nice and still for me. Okay, let's try this other side. Okay. Alright, I think I've got most of those. Alright, so finally I'm going to be using this tool here. Okay, so it's got a slightly rounded end and then a sharp end. Now I'm not going to be poking it in at this angle, okay? I'm going to be doing it like that so it will not be painful at all, okay? So I'm just going to follow along these lines and I want you to tell me if it's the soft or sharp end. Okay, that's the soft end. Soft still. Soft, okay. Sharp, okay. Please close your eyes. Sharp. Soft. Softed or rounded. Rounded, good. Rounded. Sharp. 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 Rounded. Sharp, good. 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 Okay. Yep. Yep, well done. Let's just try this area down here again. That's it. Okay, any pain or discomfort? Slight, okay. Right, I'm going to come back to that bit. Let me just make a couple of notes from what I've done. Okay. So just focusing on this area here. Is that triggering any pain? No, okay. But you're saying slight discomfort. Alright, so I just need to work out if that's nerve related or if there's something localized. Okay, so I'm just going to use my light. You've got some small bumps there, and they're not red. it could be a slight allergic reaction, okay? If you could just tip your head up just a little bit, just a very small amount, that's great, thank you. Does that bit hurt? Just there. Is that there? Okay. Alright. Okay. Okay. Alright. Bring your head back down. That's great. Okay, now I'm going to take a couple of swabs just to check for any bacteria on the skin or an infection, but it does seem to me like there's some irritation. It could be if you're resting your head on your hand here, or perhaps touching your chin, although there isn't any on the other side. I'm going to say that's not related to nerves, so that is outside of my specialism. I could book you in for a skin allergy session. Yeah, okay. Let me take a couple of swabs so they've got something to work with while I see you there. Alright, so I will pass this on to the doctor and they can have a look at that for you. In regards to your sensations and the nerves, I am really happy, there's no concerns. What I will do is have your nerves, the map, uploaded, sent to you, and then we will analyse it on the computer to make sure that everything looks fine, and we can always use that for further sessions if you'd like to keep testing those nerves there. Okay, everything inside the mouth all right? Just open wide. Okay, and swallow. Good. All right. The nerves do affect inside the mouth as well, so everything looks good. Alright. So as I said, I'll be in touch, okay? I'll send all the details across and I'll follow up with you on the skin allergy. Alright?